Plastic surgery is surrounded by myths, misconceptions, and internet rumors, and it's time to set the record straight. Today, we're tackling the most common misunderstandings we hear in the consultation room, from the non-surgical is always better trap to the reality of scar visibility and what recovery actually looks like in 2026. If you've ever wondered what's fact, what's fiction, and what's just clever marketing, this episode is your definitive guide.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evan Zug, also known as The Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by
Dr. Evan Zug.
Yeah, we're both board-certified plastic surgeons in Charlotte, North Carolina, and today we are continuing our popular myth-busting series. We've done a couple of these already, and I've gotten good feedback, which is super fun because we can hit a bunch of different things and hopefully not bore the audience, right? So we're exposing the misconceptions that persist because of social media, celebrity influence, and outdated information, ensuring you have the naked truth before you ever book a procedure. So we've listed a bunch of myths, and then Evan and I are going to go back and forth on what our opinion is on things. And then, if anybody wants to interject, we can, right? Myth number one, I'll take it. Non-surgical treatments are always better. I don't hear that a lot of times, but from a myth standpoint, injectables or lunchtime devices are safer, easier, and just as effective as surgery. Obviously, just by the way I'm setting this up, we know that that's not the case. The truth is that non-surgical tools can be awesome. They can do a great job, but they certainly have their limits, and they have this ceiling that's a lot easier to get to than with surgery, right? I mean, surgery is the gold standard, and I know you're going to hear that from a bunch of plastic surgeons. Oh, of course you're going to say that, but it is. And so that doesn't mean that there aren't really great things to do prior to having surgery, or a lot of people don't need surgery, right? Like, I mean, I used to have a attending that used to say, not everybody needs to die with a scar. I think that was his subtle way of saying not everybody needs surgery. It's not, and the best thing about being in this office, right, is that we have all the different modalities. So if our estheticians, our laser specialists, our injection experts think that they're going to hit that ceiling and that the patient would do better with surgery, then they typically come to us, and vice versa, right?
Yep.
Like, we both see people in consultation, and we're like, what are you talking about? You look awesome. Your neck looks great. You don't need surgery right now. You just need to improve your skincare regimen and maybe do some of the non-surgical things to, push this off or delay it or make it to where you don't ever even need it. I mean, there's plenty of people out there who look amazing and have never had surgery. So,
I'll just give you a quick example from today.
Yeah.
I had a patient, 50-year-old, beautiful woman, come see me, was interested in a neck and a facelift. And she really had minimal kind of jowling, some excess skin on the neck. And neck and facelift would be a great option for her. But she wasn't quite ready for that. So I had Linda come say hi to her. Yeah. And she did some filler along the jowls here.
Sure.
Was able to kind of turn up that, the corner of the lip that was downturned and fill that area. And it looked beautiful. I mean, it looked incredible.
Yeah.
It was amazing.
Yeah.
And that's a temporary thing for her for the next year.
Sure.
Until she's ready for a face or neck lift.
Yeah.
Filler's not going to help with her extra skin on the neck, but it was really pretty mild.
I think, I'm seeing more of that right now just because celebrities. There have been some really, thank goodness, there's finally been stories on plastic surgery gone well, right? Like when you see some of these people, I think the most recent that I've seen has been like Denise Richards, right? Which, I mean, genetically, she's pretty superior anyways. She was a slam dunk, neck lift, facelift. But I'm glad that whoever did her surgery did a great job. But I mean, let's not act like that's some wild result. It gets marketed that way. And whoever does it is going to say like, oh, he's got some, he or she has some different way of doing things because they, you know, and we'll get into some of those myths later, I'm sure. But finally, we've got some good results that are out there. Like plastic surgery isn't the butt of everybody's joke, right? Especially Hollywood celebrities, which just looked overdone for so long. So I have noticed that we started to see younger patients come in for facelifts and neck lifts and things like that. And while I do think it's a great idea for people to be proactive and start thinking about these things, because you're going to get a better result if you do it sooner rather than later. You just are. You're going to be younger. Your skin quality typically is going to be better. But even that being said, we see people who come in who don't have the greatest skin quality, and we get them on a skincare regimen before we even think about doing a surgery on them. And all of a sudden their skin's glowing, looks beautiful, and they're going to have the results that they would have had 15 years ago without doing this kind of skincare regimen. So, but we are seeing younger patients. And so inevitably by seeing younger patients, we've got different options for them, right? It's not just every, you know, one of my attendees always used to say, a chance to cut is a chance to cure, and cold steel is the best deal. And you're like, oh, all right, well, not really, not anymore. Now we got lasers, we got microneedling, we got all sorts of different, good skincare, fillers, Botox, all of that has really changed the whole landscape of what we do, which is awesome.
Yeah,
right?
It just depends on the patient. You know,
That's exactly right. All right, myth number 2: plastic surgery. You're going to see my scars. I mean, you got obvious scars for that. So talk a little bit about that.
Yeah. So, you know, the myth is you'll always have visible telltale sign that you've had work done. And the truth is modern surgery is about strategic placement in natural creases or hairlines. And yes, you're going to have a scar, of course. But the way that we have been trained and how we do plastic surgery is the scar is going to be as beautiful as it can be.
Right.
There are ways to make scars better with laser treatments or things like that. But it's, you know, the way that we place incisions, the way that we design our surgery, it's really
and the way we close incisions.
Yeah,
too.
the way that we close incisions.
I mean, how many times do we see something that like, oh, I had a C-section? Well, it's like, you know, there's a lot going on, and, you know, maybe a layered closure wasn't at the forefront of your OBGYN's mind or like whatever, right? But like, you know, I do feel like sometimes people look at us like we've got some magic stitch or you know, we've been anointed with some, you know, and we don't. What I tell people is a scar is the human body's way of healing an incision, right? And so it has such a bad connotation, probably starting with The Lion King, right? That dang Uncle Scar, right? What a bad guy. But when people think of scars, they think of disfigurement and stuff like that. And they don't. Sometimes I tell people, I'm like, look, if you plucked one of your blonde hairs and put it in your bikini line, that's what I want your abdominoplasty scar to look like, right? And so we do follow certain principles, and we make sure that all our patients have a standardization of how they're going to take care of their incisions. And that's for things that like, yeah, we can hide them underneath your bikini line. And when you're wearing a bra, you won't see any incision that we'll ever make on your breast, right? I do think people worry about when they talk about facelifts. So when you talk about like hiding things in creases, what do you mean by that? Like, where are we going to put these incisions for facelifts, neck lifts?
Yeah, so for the face and neck lift, you know, there's an incision under your chin, so no one really ever sees that unless they're shorter than you,
right?
Looking up at you.
And it's also, we try to place it right in that natural crease that you have.
Natural crease.
Yep.
And for the face, you know, the facelift incision that goes, you know, around the ear, it's really hidden well in the creases and natural shadows of your face.
Sure.
And, you know, especially in women with hair,
right?
No one ever sees it.
Right.
I mean, and the face just heals so well. It's just so vascular.
It's a privileged organ. Yeah. We always say that about the face and the hands, both privileged organs. Yeah. Yeah.
No one notices it. I notice it.
Right.
I see. I mean,
right, because we look at it.
Right.
Or because people come to us because they had a facelift somewhere else. They don't like the way the scar looks, typically behind their ear, because that's where there's the most amount of tension.
Yep.
But, like you said, a well-placed scar and little tricks of like, thinning out the tissue so you get that nice pretragal notch so it looks. But these are all things that that when you've done a bunch of facelift
just
necklace,
kind of
like, you just know where to
routine
put
to
it.
us.
That's
And
exactly
so
right.
It's really just about surgical. It's about educating patients. And once we talk to them and tell them about how we do this, then they understand, and it's not a big deal.
Right. I mean, how many times do you get a text message from a friend who's like, "Oh my gosh, my kid, yada yada, is this going to leave a
Always the
scar?"
mom and the kid.
Yeah. Is this going to leave a scar? I'm like, well, it's a cut. So yeah, as soon as that happens.
Yep.
So it's going to be. All right, myth number 3, recovery takes months and months. I want to talk a little bit about this because there's also the reverse of this, right? And we talked about it today, Evan, with some people who tout, 0 recovery breast augmentations, right? And you're like, that is such crap.
Marketing.
It's an absolute lie. I mean, just because your patient can put their hands over their head after their breast augmentation has nothing to do with what their recovery should be like, right? I mean, the body is going to heal along a timeline, and there's no way around that. Like, this is when the platelets come. This is when the macrophages come. This is when the collagen gets deposited. This is when the collagen gets rearranged. So your incisions, your tissues, all of those things are going to heal along the same timeline. Doesn't matter if I take a mole off or if we do a tummy tuck on you, right? And so what we say is, what type of physical activity can you do during those periods? And what I tell everybody, I say for the first 2 weeks, nothing that makes you sweat. Right? You can still live your life. You can still drive a car. You can go to work. You can be a mom. You can be a dad. I mean, heck, we do a lot of male surgery, right? And so it's like nobody's telling you can't do anything. I don't want you to get your blood pressure and heart rate up so much that all of a sudden we've got bruising or bleeding, or I got to worry about something, And then you just got to be smart about, maybe you don't sleep with the dogs in your bed for the first couple of days after surgery, right?
Yep.
Maybe, but at 2 weeks, I let people put on their running shoes no matter what, even if they did a tummy tuck. I'm like, get out there, get your blood pumping, get your cardio on. I don't want them doing core exercises after a tummy tuck, just like I don't want you doing a burpee if I just did breast surgery on you. I don't want you doing a chest bench press. Like, that probably wouldn't be the smartest thing in the world either. But a lot of times, we're having patients not do things, not because they don't feel like it. They do feel like doing these things. And that's when they're like, what the heck? Why, I feel fine. Why can't I do this? And it's because we know, hey, a lot's going on under the surface. You've got layers of incisions that are closing right now. And if you do a big herky-jerky movement or dive on the pickleball court at week 2, we may have problems. And guess what? We don't like problems, right? So it's one of these things where, does it take months and months to recover? What I tell patients is at 6 weeks after surgery, any incision that I place on you, at 6 weeks, the way that your body has done it, you are 60% recovered. At 8 weeks, you are 80% recovered. And that's why at that 6 to 8 week zone, you have no restrictions. You can do whatever you want.
Yeah.
But it does take the remainder of 1 year to get that final 20%. But it's safe to do everything at 6 to 8 weeks. Now, if we did a tummy tuck and we plicated, we brought your muscles back together, the first thing I would do after 6 to 8 weeks of not doing any core exercises probably wouldn't be go do like an HSM core class. Probably not the smartest thing. I'd probably start slow, right? And listen to your body as you go. And then so long as you're listening, and by that time, some of the numbness to some areas has come back. So you're more aware of what's going on with your body. So does recovery take months and months? Recovery takes what it takes. But your introduction back to normal daily activities, I think, is a lot sooner than people think.
Yeah.
But not as soon as some plastic surgeons and people like to try to market themselves like they have some magic pixie dust that all of a sudden, my patient had a breast aug and was out at the beach the next day. Okay, anybody's could.
Yeah.
Like, that's not some magical thing that you're doing. The body still has to heal. I don't care if you've got them on whatever medications, or you did whatever chest wall block, or you went with a smaller implant so there's not as much pressure and stretch on the tissues. Fine. It's just a question of over-marketing something, just for the sake of thinking that patients are going to have a different experience. And like, they're not. So don't buy into it.
Yeah.
You know?
And it's really not. I mean, when I educate patients and talk to patients about the recovery period, they're much more likely to have the surgery. It most commonly comes up with tummy tucks.
Sure. 100%.
But I mean, at 3 or 4 weeks, you're doing whatever you want to do other than it really, I mean, I'm going to limit some of your core activities longer if we had to placate your abdomen a little bit more, but that's where it most commonly comes up. And it's really not as bad as people think. And then when plastic surgeons say, yeah, you can go do this immediately after surgery or be on the beach or whatever. I mean, yeah, of course you can.
Yeah.
You're going to love your breasts and you're going to want to get back to doing normal things. And I'm going to tell you, no, let's wait, at least 2 weeks.
Did you run to the beach and play volleyball and like expose your incisions to UV? No, you didn't. So just because you go take a selfie on the beach or out to dinner that night, great. All our patients can do that.
Yeah.
It's just a question of like, that shouldn't be the main focus, right?
Agreed.
How soon can I get to the beach?
Agreed.
All right. Myth number 4, plastic surgery results look fake.
Yeah. So very common myth. And it's something that because this, plastic surgery results did look fake back in the day. Things were done differently. And we have learned how to do things in a way that it's a natural look. And that's really not and I think you would agree with me. I mean, the way that I approach plastic surgery is if we need to do something again, then that's better than doing too much and looking fake.
Oh, 100%. You can always tighten a little bit.
Right.
Or nip and tuck or do any of those things, but boy, is it hard to go back. And there's certainly different areas
it's
of
almost
the body
impossible
where that's,
to go back.
where that's like, we've just seen so many overdone things.
I mean, we see a lot of like secondary revision type patients who
Huge
have done
portion
things,
of our practice is
over aggressive liposuction or, I'm trying to think of another example.
Taking too much eyelid skin out.
Right.
Good luck with that.
Yeah. I mean, those are difficult problems to fix.
They're very difficult problems to fix.
If not impossible.
Yeah. So I think what I'm also just so pleasantly surprised about, right, is that I feel like we're seeing more plastic surgeons start to adopt the principles that we've had for years, right? Which is like, don't go beyond what somebody's, body is telling you to do, right? I mean, breast dogs are the perfect example of that, right? Like, I mean, the average size breast augmentation has gone from 500 cc implants to 400 cc implants to 350 cc implants. And now, you and I had a discussion today where, there's certain techniques that are being marketed like crazy out there to get people in the door who not even everybody's a candidate for it. And they're telling you, don't put an implant over 300 cc's for this. And you're like, all right, great. Like, I mean, if that's what's creating this push to have safer implants, more modest numbers, more conservative approaches to things, yeah, I'm all for it. So, and they'll definitely look less fake, which is what's awesome. All right, myth number 5, you're too young or too old for plastic surgery. The myth, there are specific magic ages to start and stop. The truth is that candidacy for surgery is based on your anatomy, the quality of your tissues, your overall health, not the date on your birth certificate, right? And so, I mean, I don't think she's going to get mad at me, but like my wife looks 20 years younger than her actual birth certificate age, right? I mean, if she wanted to do surgery, which she doesn't, she'd do much better than people 10, 15 years younger than her, especially people who have like kind of been ridden hard and put up wet, right? Like, I mean, there's a population of people who were fake bacon, suntan, and doing all that kind of stuff their whole life, never took care of their skin. Their weight has waxed and waned and gone back and forth and all these different things. And for those people, you're like, yeah, I mean, you're 25, but I mean, that's not, you start talking about chronological age and things like that. And it's, so there is no, I mean, I had somebody who came in the other day. She was so cute. I mean, and she was like 80 years old and had like 40-year-old implants that were not doing well. And she was like, well, should I just take them out or should I replace them? And I'm like, I don't know. Like, I mean, you're out and about, like you're loving life. You're like, you and your husband do all sorts of, I mean, you're active as can be. Like,
Right.
If we take them out, this is what you're going to look like. If we replace them, I think you're going to do awesome. And I mean, yeah, here's to another 40 years, by the way. She was amazing. She's like, you don't think I'm too old? I'm like, if you're healthy for surgery, I want your breasts for the rest of your life to look like you want them to look. And so, but it's just unique, like everybody's different. And I don't look at age. I don't, because man, you stand me next to my wife and everybody's telling you that I'm 15 years older than she.
Well, I mean, safety is super important, right?
Yeah.
And so we thoroughly assess all of our patients to make sure they're safe for surgery. And it routinely has shown me that age is just a number. It's not how healthy you are or how safe. I mean,
Right.
There are some super healthy older patients who we operate on all the time.
Yep. And conversely, there's some younger patients where you're like, we need to get things
Right.
Let's get things in order before we start doing surgery. All right. Myth number 6, liposuction is a good remedy as a weight loss procedure. What do you think?
Yeah. And so this is something I've done a lot of, and there are certain, so it's not a weight loss procedure. It's for contouring your body. It really is it's probably one of the most artistic things we do in plastic surgery because you're sculpting that patient to their underlying anatomy.
Right.
And you're contouring them. You're not losing really a lot of weight with liposuction.
It's funny. Yeah. People think, so the maximum amount that the American Society of Plastic Surgery tells us to do in one setting is like 4,500, 5,000 cc's, which is 10 pounds. And that's, a combined kind of fat, plus some of the tumescent fluid that comes out. And that is not insignificant by any means. But I mean, you got to hit a bunch of areas to take that off. I mean, when people grab their belly and they're like, "Oh, this is like 40 pounds," you're like, "That's not 40 pounds of fat." I mean, and then we used to have like a little blob of fat that we had next to our cool sculpting machines before we got rid of those. That was like one pound of fat. It was literally like this kind of visual aid that you could use, and the thing was the size of a brick, and people couldn't believe it. So have you ever had somebody that comes to you and they're like, 30 pounds overweight, and they just come and tell you, "I want you to liposuction everywhere"?
Not often, but yeah, sometimes.
Yeah. So what do you tell that person?
Lose some weight.
Right. And so tell them we have a weight loss program, and then Morgan's going to help you lose
weight. We get them
weight.
set up with our weight loss program.
100%, because, losing weight is going to have you lose weight from everywhere, right? Liposuction is for a particular stubborn area is what I tell people. I'm like, look, if you've got 30 pounds to lose, that's why we ask every patient, current weight, max weight, goal weight. And if your goal weight's different than your current weight, my follow-up question to everybody is, what are you going to do to get there? How realistic is it that you're going to get there? Because if it's not, then let's talk. Like, if you're 180 pounds and you think you're going to be 120 again, like you were in, before you had kids and before college and all this kind of stuff, you're like, yeah, I'd love to be 170 again and have a 6-pack. It's not going to happen, right? As much as my wife wants it to happen, it's not going to happen, right? So you're just kind of like, what's realistic for your life now, right? Because I'm not playing soccer every day like I was when I was 16, 17, 18 years old. I don't have the same metabolism. I've got way more gray hair, right? So it's like I don't have the time to do the things that I did back then.
Yeah. And
still,
we operate on people who are not at an ideal weight all the time.
Perfect.
But I think the really important part is setting expectations with those patients.
Right.
Because even, I'm not just talking about body or breast, I'm talking about the face as well. If we do something for your face or neck, like liposuction or face and neck lift, you're not going to get as good of a result if you're not at the ideal weight.
Right.
And so I take a lot of time with patients educating them on that. Yeah. We can do your neck lift.
Yeah.
I mean, we can do the liposuction of your neck, but it's not going to be what you think it's going to be.
But people also know, right? It's like, it's the age old thing about using BMI, right? Like, I don't use BMI for anything.
No.
And so it's like, because patients know when they look their best, right? Because nobody started at 200 pounds. So you know what you look like at 160, at 170, at 180. I look emaciated at 160. I look the best at 175. All right, awesome. You just defined it. 175 is the best. So how do we get you there? And then if there's anything stubborn, there's anything that we need to, I've always hated this little pooch that I've had. I've never been able to get rid of this. I've always felt like I had fat arms. Always hated my knees. Whatever it is, we'll knock that out.
Yep.
But like, don't come to me 30 pounds and think that I'm going to liposuction 30 pounds, because I'm just not.
Correct.
Right? Like there's no way to do that.
Yep.
All right. Myth number 7. If I work out enough, I can avoid surgery. Okay. There are things that happen to your body. I'm specifically kind of mainly talking to women, right, who have had kids, that it doesn't matter what you do in the gym. It starts with your musculoskeletal system, right? That's the framework. That's the foundation for everybody. And then our skin drapes over that, right? So we'll talk about skin after that. But from a musculoskeletal point, you always talk about the muscles separating during pregnancy, and that's called diastasis. And that's what people come in and they pronounce it wrong, say it wrong, all those types of things. But that's what it is. And it's basically your six-pack muscles are held in the midline, in the middle of your body, going from the bottom of your breastplate all the way to your pubic bone. They're held in line by a connective tissue layer, and that connective tissue layer is what stretches out. And then you have your baby, and typically, like maybe after the first baby, you bounce back and you look awesome. You're like, that was great. That was easy. I don't know what people are talking about. I'm gonna have a second baby. Then you have a second baby. And whether it's your second baby or third baby or fourth baby, 95% of women that come in here for a tummy tuck after childbirth say that it was the last baby that did it for them.
Yep.
You're like, really? Oh, okay. All right. Yeah. Yeah. It wasn't the third. It was the fourth. Or it wasn't the first. It was the second. That's exactly right. So you've got to kind of, you've got to understand that there's no amount of crunches or sit-ups or anything. Or sometimes this is also something that is a little sad. Women will have weight loss, which is awesome, and they'll have kind of flabby arms. And they're like, I don't like my arms, but I'm back in the gym now, so I'm gonna build muscle, and everything's gonna, I'm like, you're gonna fill up your skin envelope of your flabby arms with muscle? Like, are you Arnold Schwarzenegger? I don't know how that's possible. Like really hard to do. So it's instances like that where I'm like, how big do you want your arms? Because if you're filling up to where your arm is right now and you don't like the size of your arm, that it's too big, we're not going in the direction you want. So it's important for people to know that there are some things that you just can't fix, right? And you sure as heck can't go into the gym and improve floppy skin, right?
I will say this. I mean, you can fix a lot with being really fit.
You want to know the best thing you can fix being young?
Can't.
The best thing that you can fix with exercise is your butt.
Yes.
Right.
Yes.
And so 100% people do that incorrectly. They think they're going to do a bunch of air squats, and all of a sudden they're going to be fine. Like, there are literally programs designed for you to add volume to your rear end, to add shape, to do those things, which I think is way better than flying down to Miami or flying down wherever and getting 500 cc's of fat injected.
Most of the shape of your buttock comes from muscle,
I
not
hope so.
fat.
I hope so.
And so when we do fat grafting to the buttock, that's fat. That's not muscle.
Right.
But you can do a lot if you exercise.
And see, that's the same thing like what we were talking about earlier, is that I think that using a little bit of fat to fill in indentations, to fill in what we call hip dips, right? Just to kind of help give a little bit of volume, I think is great. But I mean, if you're looking at going from like flat butt Betty to like what's the term that the kids, yeah, right? Like that's not going to happen, right? Like if you do that through fat grafting, you may look good for a little while. I mean, you're really not, but it's going to look horrendous as you age.
Yep.
And then it's just a huge problem with patients. So I am fully in favor of doing some buttock augmentation with either your fat, right, or off-the-shelf fat like Aliclay, fixing indentations from cellulite, those types of things, and also improving the skin on your rear end. You just heard it. Yep. Like Morpheus radiofrequency microneedling, game changer for the rear end. You do that with a little bit of fat grafting, a little bit of Ovally for cellulite, things are going to go great.
The large volume fat grafting, I just not a fan of.
Well, yeah. And if you're, who's the one that it stinks? Her butt stinks?
Oh, yeah.
One of them. Nicki Minaj?
Yeah.
Something like that?
Yeah, something.
Poor
I
thing.
think that was her.
Poor thing. Poor thing. All right. Yeah, actually, somebody texted me and was like, here's the other thing. Patients, we love you. We don't have you like programmed in our phone. So when you text us and it's like from a random number and it's like, hey, I heard such and such about plastic surgery. Is that true? I don't know who you are, right? Like, I mean, some of you I become really good friends with, right? Some of my best friends are patients. But like, just give me a little like dash and then your name so that I know who I'm responding to. But they were talking about, hey, I heard BBL's smell. Is that true? I was like, oh, well, we'll address it today. If you've got so much fat injected in your rear end that it's starting to die, yeah, like that's not going to be good. Any tissue that is necrotic, that is ischemic, smells, and it's going to emanate a smell. So if you throw a bunch of fat in your rear end and it doesn't all survive,
Yeah.
you're going to have problems.
Was it Cardi? Was it Nicki Minaj? I'm trying to remember. One of them has butt implants. One of them has fat
I don't
grafting.
mean to
can't
speak
remember.
ill of all of them. They're all beautiful women. Even Megan Thee Stallion, like I don't want any death threats or anything like that. Everybody's beautiful, but those are the three women that come to mind when they start talking about, and like Kim Kardashian, right?
Yeah.
Like you start talking about like huge rear ends. She didn't have that huge rear end anymore. So like, what happened? Where'd it go? Matter cannot be created nor destroyed. So it went somewhere. I think she's learning from her mistakes as well. All right, myth number 8. If you stop Botox, your wrinkles get worse.
No, they just go back to where they were.
Yeah, right. That's pretty easy. Myth number 9, plastic surgery results are instant. Boy, if you look at some of the social media from some other plastic surgeons, they'll tell you, oh, I mean, immediate, right? Like, I don't know of any result in plastic surgery that's immediate. No. There's nothing that doesn't take time for the tissues to settle, for them to get rid of swelling, for them to, I mean, I tell patients like for tummy tucks and liposuction, I tell patients like your best, when I want you to come in to take pictures is at 6 months.
Yeah.
And the reason why I say that is because you're swollen, you're not working out, you're eating comfort foods for like, a few weeks after. It's not till 6 to 8 weeks that you can exercise all you want. And then for the next 3 months, you're close enough to your surgery date to where you have the motivation of like, I'm not going to let this go bad. I'm going to optimize this as best I can. And you're like looking in the mirror and you're so daggum excited that you're ready to push it to the next level. You know what I mean? It's like, it's just interesting how that works sometimes.
I mean, the messages I get from patients at 1 year and 2 years after surgery, how much they love their result.
Right.
Is, I mean, that just shows you. But I think where patients get confused on social media most commonly is with primary breast augmentation.
Yeah.
That result's not instant either.
No.
I mean, even, there's much less swelling.
Yeah.
It heals very quickly.
Well, there's some people who are like reinflation cases, right?
Yeah.
Where somebody's had kids and you're like, there's not a lot of stress to their tissues. We joke around back there. We don't joke around, but the saying is, this person was like born for this implant. right? Because it's like, oh my gosh, it just filled it up great. Like there's just not going to be a lot of stress after that surgery. And then you have some people who have very little breast tissue, and it's going to take time. They're going to look operated on for a while before it looks more normal and more natural, which is always the goal. Yep. And then myth number 10, all plastic surgeons perform cosmetic surgery. Like you got plastic surgeon.
We were talking about this today.
Yeah.
I saw something that 50% of the plastic surgery done in this country is by non-board certified plastic surgeons.
That's insane.
And I was shocked.
That's insane. That's absolutely insane to me. But, you know, it is a law, whichever way you want to look at it. All you have to have is a medical degree.
Yeah.
And you can do surgery. And there are some companies in plastic surgery, right? There's some implant companies that refuse to put their products in hands of non-board certified surgeons that are doing it, right? They only give it to board certified plastic surgeons. And we should commend people for that. I mean, everybody's got their own business model. I get it. It's like Chick-fil-A being closed on Sunday. Why in the world would you be closed on Sunday? That's a weekend. That would be one of your best days. Like, oh my gosh, it doesn't make sense. Well, there's probably a lot of people who really respect that about Chick-fil-A and maybe choose Chick-fil-A over other places because they make those decisions. And that's how I feel about some implant companies.
Yeah.
And
I mean, the sad thing is, it's not just, you know, we need to be better as board certified plastic surgeons. It's not just education, because patients are still going to look at pricing.
100%.
And we need to lobby our American Society of Plastic Surgeons. We need to make that better.
Yeah. Well, I mean, I agree. I don't think that like 50% of bypass surgeries after heart attacks are done by non-cardiothoracic surgeons, right? Like, and so, and my roommates and buddies in med school would laugh at me for saying that, because they're real doctors and I'm just a skin doctor. That's what they like to tell me whenever we get back together. And then I just ask them how call was that past week. Nanny boo boo. But yeah, I mean, the truth is that you want people who do the surgery that you're looking at getting done all the time. And you want people who have an amazing reputation at that surgery, because there's plenty of plastic surgeons who never do cosmetic surgery. I mean, and I tell people, you don't want me doing your free flat breast reconstruction, because I just don't do it anymore.
Some of my most incredible mentors in plastic surgery never did cosmetic surgery.
Right.
Cleft lip.
Yeah.
You know, cranial reconstruction.
Those are so fun. Right. But you don't want that person doing your tummy tuck.
Amazing surgeon, but you don't want them doing your tummy tuck. Yeah.
100%. All right. Rapid fire myth round. Myth. Surgery results last forever.
Fortunately not.
Myth. Breast implants must be replaced every 10 years.
Not true.
Yeah,
unless you're having a problem.
Like, that's crazy talk. Myth. Recovery is extremely painful.
Not true either.
Yeah.
Most of my patients are all pain pills by day 3.
Yeah.
If I'm doing a facelift, tummy tuck, liposuction, breast surgery, anything, it's not that bad.
I just think we have a better handle on post-operative recovery now.
Yeah.
I do. And I think it's all sorts of, I think it's, right. Some of it's medication. Some of it is anesthesia, local anesthesia, regional anesthesia blocks that we can do. It is the advent of incorporating things like lymphatic massage therapy, red light therapy. All those things are fan-freaking-tastic for patients. And really, so long as you follow instructions and don't overdo it, don't do too much, your recovery is going to be pretty by the book.
Yeah.
Right? At least that's what I'm looking for wood, knocking on wood. All right. The best decisions come from real information, not internet rumors. If you've heard a myth you want us to tackle, or if you're ready for an honest consultation, visit us at ghsurgery.com or call 704-375-7111. Your voice matters to us. Visit ghsurgery.com and click on the Doc Dudes link to submit your questions. Make sure you're subscribed so you never miss an episode. We drop a new one the last Tuesday of every month. Find us on Apple, Spotify, YouTube Music, and follow us on Instagram and Facebook for the latest from our practice. Thank you so much for listening. This is Dr. Garrett Harper along with
Dr. Evan Zug.
Peace.